I'm Ben Brown for the ABC 15 political team. Republican-backed legislation would make some big changes to Medicaid.
In some ways, this is one of the most significant changes in Medicaid law ever in the history of the program, going back almost 60 years now.
Burton Smith, a former Medicaid director in Michigan, said the biggest proposed change to Medicaid centers around a work requirement for childless adults.
The reason that's so significant is that it's not designed to put people to work. It's designed to have kind of a red tape paperwork requirement that is difficult for people to satisfy the requirements for.
Another health policy expert we spoke to agreed.
I think history shows us the more hurdles and bureaucracy you put in the way of accessing benefits, the fewer people are able to do that.
Both noted that it's not the work that's the issue, but all the paperwork associated with the process.
I think the challenge becomes when you're applying those requirements to people who have very, very complex healthcare needs, people who are receiving treatment for fentanyl addiction, people who are getting chemotherapy for cancer. How do you make sure that those individuals are not caught up in bureaucratic requirements that result in them losing their healthcare?
While the Republican-backed proposal would save billions of dollars, according to the nonpartisan Congressional Budget Office, it would also result in millions losing their health insurance.
The Congressional Budget Office forecast is that maybe as many as 300,000 Arizonans who currently have Medicaid coverage will fail to meet the reporting requirements.
The package failed to pass through the Budget Committee on Friday, with some conservative lawmakers wanting steeper cuts to Medicaid. Smith said he expects more drastic changes after Republicans go back to the drawing board.
We still have a long ways to go before we get to the finish line.
Ben Brown, ABC 15, Arizona.